Okay, so today we're going to be doing an NG tube insertion. I'm going to first verify the order. I'm going to verify hospital policy. I'm going to perform hand hygiene. I'm going to do my two identifiers, Jaguar J. Jones, MR number 4176352, MR number 4176352. Allergies are penicillin, and he has a penicillin allergy band on. So then I will be explaining the procedure to the patient. Today I'm going to be doing an NG tube insertion. I'll also provide the patient with privacy. And then I'm going to gather all my equipment that I will be needing for the procedure. I'm going to throw on my goggles. I'm going to make sure that I have my stethoscope and my pen light ready for use. I'm then going to perform hand hygiene again. I'm going to make sure that the bed is at a working height, that the side rails are lowered, and that now I'll be assessing the vital signs. I'm going to do the O2 sat, and then I'm going to be looking for listening to the bowel sounds. If there is a decrease in O2 sat or a deterioration of vital signs, I would be not doing the NG tube and waiting for the patient to be stable. Now I'm going to raise the bed to a high, or raise the head of the bed to a high Fowler's position. Then I will be establishing a cueing sign with the patient. So today, if you are feeling like you need to stop the procedure, just tap on my arm. Then we're going to be opening the package. Opening the NG tube package. I'm gonna get the water-soluble lubricant, and I'm going to put a dollop of it onto the packaging, the inside of the packaging. And then I'm going to loosen the syringe. I'm gonna now put on a pair of clean gloves. So I will be getting the patient to close one of their nares, breathe normally, close the other nair, and breathe normally, and then we would see which one was the best one to use for the NG tube insertion. We picked the right nair, and so now we're going to be cleaning the bridge of the nose with an alcohol pad or soap and water. And then we will pat it dry. Okay, so now we're going to be putting on the towel over the chest. We're going to put the basin onto the abdomen, and that will be where the end of the NG tube goes. Okay, so now I'm going to be coiling my NG tube. I'm going to lubricate 4 inches. So before I start, I'm going to get the patient to lean their head back onto the pillow, and then I'm going to insert the NG tube. So once I get past the nasopharynx, I would get the patient to tilt their head forward. I'm going to get them, I would have this near them, so it would be easy access. I'm going to get them to take little sips of water. Then I'll advance it 1 to 2 inches at a time, rotating at 180 degrees until I hit how far I needed to advance. Okay, so now we'll be, if the patient were to cough during this procedure, have respiratory distress, or decrease O2 sat, I would make sure that we that we pulled it to the posterior nasopharynx. I would stop until their breathing sounds were normal, and then I would get them to swallow, hold it, and I would advance the tube. So now we're going to be putting our temporary tape on. onto their cheek. Okay. So after this, I would make sure that I looked with my pen light and my tongue blade into their throat to see the placement of the NG tube. And then I'm going to connect my syringe to the end, and this would be if I was aspirating gastric contents. So if for checking for the NG tube placement, I would aspirate gastric contents. I would assess the pH if indicated. I would do an x-ray if ordered. And so now we're going to so now we're going to do the permanent tape. I'm going to take off the temporary tape and do permanent tape. Okay, so now that the tape is on, I would connect to the suction. I would turn it on low suction as indicated. But before I did any of this, I'm going to be putting this piece of tape over their nose, and I'm going to put the indications, and then it would be if the NG tube got displaced. So we're going to be putting that over the nose. Okay, so after that, I would connect it to suction, make sure it's at on low suction. If it weren't to be suctioned, I would do this and close it. Then the blue pigtail is always above the stomach. Okay, so now we're also going to make sure that this is pinned to the gown. I'm not sure if I said that. The bed, we're going to leave the bed at no less than 30 degrees, and we're going to lower the bed, make sure that the side rails are up. We're going to make sure that the patient's comfortable and that they have their call light. So now we're going to be removing gloves. I'm going to clean up my equipment. Okay, so, excuse me, my hands are a little sore. Okay, so I'm going to perform hand hygiene. I would have also, when I was cleaning up, I would have removed the towel. But I'm going to perform hand hygiene. I'm going to don some more clean gloves. Okay, so after I got done with my procedure, I would be documenting how the patient tolerated the procedure, the size and type of NG tube. I would make sure that I put the time and the location, would see if they're secure, where it was secured on the patient, and I would see the placement, the characteristics, the amount, and color of the secretions. So now we're going to be doing a removal of the, I'm really having a hard time with my gloves. I'm so sorry. My hands are really sweaty. So now that my gloves are finally on after 5 minutes. Okay, so we would be explaining the procedure to the patient. So today I'm going to be doing a removal of an NG tube. I'm going to auscultate any bowel sounds. I'm going to check their O2 set. And then I'm going to also check their order for it. And it is here for removal. Okay, so now we're going to take off the tape. Permanent tape. Okay, so I'm gonna also, if the suction was on, I would turn it off. And then I'm gonna tell the patient to take a deep breath and hold it. I'm gonna kink the tubing and pull it out smoothly. Okay, so I'm gonna discard of this. I'm going to make sure that I verbalize that I would measure drainage, perform oral hygiene, and do documentation. And that's going to conclude my NG tube insertion.